What is apraxia? Does it happen in kids or adults? Are you looking to learn more about this because a family or friend has recently acquired apraxia? What does a speech pathologist do? Well, here's a quick crash course on acquired apraxia of speech in pro-stroke victims.
First off, what even is a stroke? Well, there are 3 types of strokes that can occur. First, there are ischemic strokes. That means that oxygen flow to the brain is cut off due to a collapsed blood vessel. Second, we have hemorrhagic strokes, which are typically more traumatic and involve the bursting of a blood vessel, which leads to bleeding in or on the brain. Lastly, we have what's called a TIA, or a transient ischemic attack. This is when a blood vessel temporarily collapses and can be an indicator or precursor of a more serious stroke in the future.
But wait, don't stroke victims always develop aphasia? Well, yeah, some of them do, but depending on what area in the brain their stroke happened, it can have different effects on the body. Patients who suffer a stroke in their motor cortex, the area of the brain involved with programming, monitoring, and sending messages to the muscles, often develop apraxia. Patients who suffer from strokes in their language centers, such as Broca's or Wernicke's areas, acquire aphasia, a language disorder in which patients have trouble with lexicon and fluent speech production.
So we now know that strokes can affect all different parts of the body, including muscle tone, cognitive functioning, speech production, eyesight, and more. One way a stroke victim may be affected is by acquiring apraxia of speech.
Kids can develop childhood apraxia of speech, or CAS, for unknown reasons, but we are going to focus on acquired apraxia of speech, AAOS, primarily in adults for the remainder of this video.
According to ASHA, the American Speech and Language Hearing Association, apraxia of speech is a neurological disorder that reflects an impaired capacity to plan or program sensory motor commands necessary for directing movements that result in phonetically and prosodically normal speech. But what does that even mean? So, basically the brain sends impulses or messages to your muscles to tell them what to do. Think about mailing a letter. Your brain is the sender, the impulse is the message, and your muscles are the receiver. In patients with apraxia, the brain, or the sender, struggles to compose the message. Along the way, the letter gets wet and the ink gets smudged. So the message, or the impulse, is hard to read for the receiver, your muscles.
This communication breakdown, in conjunction with poor muscle tone in the face, tongue, and lips, can lead to distorted speech that may be difficult to understand. For this reason, communication efforts can change in a person's life after they have a stroke and acquire apraxia. Regular communication between the person with apraxia and family members or friends is very important. Here are some tips to keep in mind. It's important to remain calm and be patient. One should wait for the person to try to communicate their entire thought and not interrupt them or finish their sentence. In some cases, an AAC device, Alternative Augmentative Communication Device, is involved. It can help if you, the person they are interacting with, start to learn how the AAC device works. It can help increase communication success and limit frustration.
In public situations, people may not know someone has a communication disorder and can become easily frustrated or rude. This can lead to a decrease in self-confidence and lack of desire for social interaction for the person with apraxia. Seeking therapy from a speech pathologist can help the individual increase their intelligibility or comprehensible speech. They may also benefit from seeing a mental health professional. They may help them cope with the negative feedback from outside communication partners and the emotions that can arise after having a stroke and acquiring apraxia.
After a patient has a stroke, they typically get a referral to a speech-language pathologist. Wait, what's that? Well, a speech pathologist is a certified professional who works with the patient's feeding, swallowing, and all aspects of communication to summarize it. Speech pathologists may begin by collecting the client's medical history and then performing a swallow exam. This is to make sure that it is safe for them to eat, as we have learned some of the key muscles for eating and swallowing may be affected by a stroke and can make it dangerous for the patient to eat some foods. For example, if there is not adequate closure of the airway, some food may be able to escape into lungs and will the patient be more susceptible to an aspiration pneumonia. Next, a speech pathologist may assess their communication skills by completing an oral mouth exam, in which they look to make sure all of the structures in the mouth are okay. They're going to have a dialogue conversation with them and watch them communicate with different partners in different settings. If they see the signs and symptoms of apraxia, they will further investigate and can then diagnose the patient with acquired apraxia of speech.
When receiving speech therapy, it's important to make sure that the client's needs and wants are addressed and are used to set therapy goals. It's important to be an advocate for the person receiving therapy and support them. Don't be afraid to ask the SLP and other medical professionals for help. They're there for you and want to support you in any way they can. Thank you for watching!